In the nonprofit space, we're always talking about impact, and the milk from a donor could save a baby's life. And I can't think of a better impact than that.
Through patient and family assistance, we help families in those non-medical ways that really become a challenge for them, that become barriers for them because they have a child in the medical or behavioral health system.
My name is Rebecca Heinrich, and I am the Milk Bank Director here at the Rocky Mountain Children's Health Foundation.
I'm Lee Shaughnessy. I'm the Director of Programs for Rocky Mountain Children's Health Foundation. Our foundation is really unique in that we have 3 very different programs with the overarching kind of central cause of taking care of sick children and their families. We do it nutritionally, emotionally, and financially.
Mother's Milk Bank has actually been around for over 35 years. It takes donations from parents in the community who have more milk than their baby needs. We test it, we process it, we pasteurize it, and it gets sent out to neonatal intensive care units in Jeffco and actually all across the country. With that, we do offer lactation support for free through our Baby Café. We have one here and we have one at the WIC office as well. In the community, we want to make sure that mothers feel supported, that they understand what cues they're getting from their baby, and how that translates to a robust and healthy milk supply.
Through patient and family assistance, we actually serve families with children before they're born through their adult years with kind of helping their families with the non-medical support services that they need as a result of their children's illness. Families that are struggling because it's a long way to get back and forth to the hospital all the time. It's tough to pay rent if you've been in the hospital with your child having a bone marrow transplant. It's everything from medication assistance to literally big things like rent and mortgage and car payments and other kinds of bills.
Related to Mother's Milk Bank, we have the opportunity to serve milk to premature infants who need it. And this is really life-saving nutrition, just critical for these little babies. If you don't have a baby in the NICU, then maybe you don't know that this is a thing. And so our job is to make sure that everybody knows that this is an option, whether it's because you need milk or it's because you have milk to share.
This is a team effort. We are not the 2 people who single-handedly make this work. We have wonderful teams that are kind of working very hard and very quickly to respond to these families. We were made aware of a 7-year-old girl with autism who absolutely was drawn to and loved water, but didn't know how to swim. Her family was really terrified. And so the advocate who came to speak with us to make a request to us said, we really need to find this kid some swimming lessons. They actually were able to find someone in the Jefferson County area who specialized in working with kids with special needs. And so we paid for the cost of 3 months of swimming lessons. And at the end of the 3 months, we actually had this wonderful picture of a little girl floating on her back with her instructor right next to her. It was one of those, that one felt really, really, really concrete and really lovely.
In 2022, the big concern in milk banking was absolutely the formula crisis, with parents being concerned about the ability to feed their infant. I mean, that's a level of fear and terror that we absolutely don't want in our community, for our neighbors, for our friends. The milk bank actually received some funding to really ramp up and produce more milk so that beyond what the hospitals needed, we had more milk for the community. Babies that would normally be able to find a specialty formula, but they can't find it. The alternative is going to be mother's milk, and we were glad that we got that option for them. We want to make sure that any baby who needs human milk has access to that, regardless of the ability to pay.
It's incredibly gratifying. There's a level of pressure to just maintain. Jonas Salk actually said that the reward for a job well done is the opportunity to do more. And I very much feel that that is true for us, is that we really recognize that what we're doing is special and important. I feel very honored to be in the position to do it, to be there at a pivotal time for a family. But it's just like, don't stop now. I can't imagine.